So welcome to RAAONLINE. So today's class is on secondary survey. So when a trauma patient comes, we usually give you a scenario while teaching, right? So a patient, I'm calling you that a 23 years old male was climbing a tree and suddenly he fell down and he has sustained certain injuries and the patient is being brought to your ER. That's a phone call you receive. So what will you do? Number one, you prepare yourself, personal protective equipment. Second, you inform your team members. Number three, you prepare your department. Okay, your equipment has to be made ready, and you prepare the other departments when and where required. Then now I will say the patient has reached your ER. So a proper handover process has to be there. Simultaneously, triaging has to take place. Then simultaneously, your initial assessment has to start. What is initial assessment? Your primary survey and secondary survey. In primary survey, airway with C-spine, breathing with ventilation, circulation with hemorrhage control, disability, and E for exposure, right? This is your primary survey along with the adjuncts. From jumping to primary survey to secondary survey, you need to think of three things. What are the three things? My patient is stable or stabilizing in primary survey, so I'm going to secondary survey. Second, I'll consider for transfer if at all my facility is not able to handle this particular patient. And third, so once you are considered for transfer, once you have did all your adjuncts, and once you are considered for all the blood reports is kept ready, you can move to secondary survey, ask for ample history, AMPLE. Okay, so ample, consider transfer, stabilization. Then you have come to secondary survey. Secondary survey is basically, the idea is not to miss out anything. Okay, it's a head-to-toe approach. Even a small aberration has to be documented. This is called secondary survey. So after secondary survey, you need to do certain things, okay, like hypothermia prevention, documentation, counseling, injections if required, all these things. So now we are in the secondary survey. So remember, only if your patient is stable or stabilizing or improving in your primary survey, then only you can come to secondary survey. If your patient is not stable in primary survey, there is no point in doing secondary survey. If you move to secondary survey, we'll make sure you fail. Okay, with the patient's BP is 60/40 and you're doing your secondary survey, definitely you're going to fail, right? Your patient has to be stable or stabilizing or improving, like saturation is improved, BP is slowly improving, then you can go ahead with your secondary survey, right? So maybe simultaneous with your primary survey, because what we are teaching you is a vertical type of thing, one after the other. But in a real time situation, if you have more manpower, you can start with simultaneously as well. But your primary survey should not be interfered, since because you do a secondary survey. So it's always primary survey, then secondary survey. Okay. So secondary survey is a head-to-toe evaluation of the trauma patient. That is a complete history, physical examination, including reassessment of the vitals. Okay. Each region of the body is completely examined. Okay. It's head-to-toe approach. Okay. Remember, the potential for missing an injury or failing to appreciate the significance of injury is extremely great, especially if the patient is unresponsive or the patient is unstable. You got the point. Maybe you will miss an injury, or even if you find an injury, you may not know how severe it is, right? Especially if the patient is unconscious or the patient having a spinal injury where he is not able to appreciate pain and tenderness in the lower limbs, right? Only when you're doing a pelvic compression test, if there's the pain, we'll know that the patient is having a fracture or some trauma, right? If the patient is having a spinal injury where there is no pain in the abdomen, there is no pain in the pelvis, there's no pain in the lower limbs, then even a fracture can be missed out, right? So if the patient is unresponsive, unstable, under the influence of drugs or alcohol, then missing out an injury is very, very common. So now comes to the stable or stabilizing and comes to the history. In history, we call something as ample, AMPLE. Okay, so you are doing primary survey. After your primary survey and adjuncts, you are switching to secondary survey. During the transition, you're asking for three things. Number one, number two, number three. Number one is stable or stabilizing. Only then I'm going to secondary survey. Next is ample history. Okay, consider transfer. Okay, then coming to secondary survey, right? So stable or stabilizing, now ample history. Every complete medical assessment includes a history of mechanism of injury. Okay, so this kind of what happened exactly, the mechanism can be obtained by the patient. But most of the time, the trauma patient himself will not be stable enough to give you a history. Maybe may not be conscious enough to give you a history. So such information has to be obtained only by from the pre-hospital personnel or the family or the bystander who was the patient. Okay, so now coming to the ample, AMPLE. What is ample? A stands for allergy. What medication is the patient allergy? M stands for medications currently used. P for past illness or pregnancy. L for last meal. E for events and environment related to the injury. Okay. What type of environment? Was it a blast injury? Was it contained into a closed room during a thermal injury? All these things matters. This is called ample history, AMPLE. Some injuries can be predicted based on the direction and amount of energy associated with the mechanism of injury. Injuries are divided into two broad categories, the blunt and penetrating trauma. Okay. So other type of injuries for which historical information is required is the thermal injuries or any hazardous chemicals if it is involved or any drug related injuries. All these things is separately we need to know. Okay, it's a blunt or penetrating or thermal or electric injury. All these things we need to know separately.